Bismillah.
Okay. The maxilla, I said that it has 4 processes. Yes?
Yes.
Frontal, zygomatic, alveolar, and palatine process. The palatine process of 2 maxilla connect together and make anterior part of the hard palate, which you can see at this slide. I said that the palatine process are triangular plates which they have superior surface and inferior surface. The superior surface of palatine process made the floor of the nasal cavity. Inferior surface made the roof of oral cavity. When two palatine process connect together, they made a suture which is named intermaxillary suture.
Is there another name for it?
Yeah.
Another name?
When two palatine process of 2 maxilla attached together, they made intermaxillary suture. Just posterior to incisive teeth, here we can see a fossa, which is named incisive fossa. In the depths of this fossa, you can see a canal which is like wide. Okay? Yeah. At this area, you can see a fossa which is named incisive fossa, just posterior to the incisive teeth. Incisive fossa travel superiorly and made 2 branch, which these 2 branch arrive to the floor of the nasal cavity in the anterior side. Okay? The structure which passes through incisive foramen or incisive fossa are nasopalatine nerve and greater palatine artery. Nasopalatine nerve from the nasal cavity insert to this canal. Greater palatine artery from the posterior of the oral cavity travel anteriorly and insert to incisive fossa. Posteriorly, 2 palatine process connect to horizontal plate of palatine bone and make this suture. What is the name of this suture? Palatomaxillary suture. It is located between palatine bone and maxillary bone. It is named palatomaxillary suture. Also, superiorly, when 2 palatine process attached together at the midline, they make a crest, which is named nasal crest at the midline. Nasal crest is the site of attaching the vomer. Okay, vomer attached to nasal crest at this area. You know that maxilla contains maxillary sinus. Maxillary sinus is the biggest sinus in the paranasal sinus, which it is appeared in the 17 years during development. The maxillary sinus at the inferior part, when arrived to the alveolar process, it is separated from alveolar process by a thin bony lamina. However, in some people, maybe the sockets of the alveolar process are does not separate it from the sinus. I mean that just a mucosa separates the sinus from the alveolar process. So, if you go to dentist during removing the teeth, we will have a fistula between oral cavity and the maxillary sinus. It is named oroantral fistula, OAF, or oroantral fistula. Another explanation is about the fracture of the body of maxilla. Because posteriorly, the body of maxilla is the site of attaching of some muscles. During fracture, the body of maxilla made this shape. It means that posteriorly, the posterior teeth, the molar teeth, connect to molar teeth of mandible. But anteriorly, they cannot connect together. It is named anterior open bite. Okay? Anterior open bite is, which you can see here, it is a sign of the fracture of the body of maxilla. Another bone is palatine bone. I said that palatine bone, as you can see, has vertical or perpendicular plate and horizontal plate, and it has three processes. Look at here. It is perpendicular plate at this area, and at this area it is perpendicular plate. Here you can see horizontal plate. Horizontal plate made posterior 1/4 of the hard palate. Look at here, it is hard palate. Anterior 3/4 of hard palate is created by maxilla. Posterior 1/4 is created by horizontal plate of palatine bone. Also at this view, you can see that the perpendicular plate made some part of the lateral wall of nasal cavity. The perpendicular plate anteriorly covers the maxillary hiatus. Yes, look at here. It was maxillary hiatus. It was perpendicular plate. Anterior border of perpendicular plate covers the maxillary hiatus. Posterior border of perpendicular plate connect to medial plate of pterygoid process. Okay? It is medial plate of pterygoid process. The perpendicular plate has two surfaces. Medial surface covers the lateral wall of nasal cavity. Lateral plate, I said that, attached to maxillary bone. Look at here. It is lateral surface of perpendicular plate. Lateral surface contains a groove. This was greater palatine groove. Greater palatine groove connect to the greater palatine groove of maxilla and made greater palatine foramen. Superior opening of greater palatine foramen is pterygopalatine fossa. Inferior opening of greater palatine foramen is here. Is located at the posterolateral side of horizontal plate. It is horizontal plate. Posterolateral side is the site of opening of greater palatine foramen. Okay? Look at here. Another part of the lateral surface. I said that lateral surface attached to maxilla. So it has a broad area which attached to the maxillary bone. It has a smooth area. This smooth area contribute to make the pterygopalatine fossa. And in the medial surface, as I said that, contribute to make the lateral wall of nasal cavity. It has two crests, conchal crest and ethmoidal crest. Look at here. Here is medial surface. Inferiorly, it has conchal crest is the site of attaching inferior nasal concha. Ethmoidal crest, it is ethmoidal crest, is the site of attaching middle concha of ethmoidal bone. So, look at this smooth area. This smooth area is related to the meatus. Here is related to which meatus?
Middle.
Inferior meatus. Okay? Here is related to middle meatus and here superior meatus. They are the specific features in the lateral and medial surface of perpendicular plate.
So the ethmoidal crest makes it attaches to the middle trunca and makes the tract.
Look at here. Ethmoidal crest in the medial surface of perpendicular plate. It is maxilla, it is perpendicular plate. They have ethmoidal crest, which middle concha of ethmoid attached to this crest. Okay, here. Ethmoidal crest of palatine, ethmoidal crest of maxilla. They are located in the same line. The horizontal plate, when two horizontal plates attached together, they made posterior part of palate, and at the superior surface, they made a crest, which is named nasal crest. This nasal crest is continuous with the nasal crest of maxilla, and it's the site of attaching the vomer bones. Okay? And also, at the posterolateral surface, we have foramen of greater palatine. I said that palatine bone has three processes: pyramidal process, sphenoidal process, and orbital process. Here, look at here. The superior border of perpendicular plate made two process. Anteriorly is named orbital, posteriorly is named sphenoidal. Look at here, at this area. It is anterior process and it is posterior process. Posterior process attached to inferior surface of body of sphenoid. It is named sphenoidal process. Anterior process, look at here, made a small part of the floor of the orbital cavity. So it is named orbital process. Okay? A small part of the floor of orbital cavity. We have a notch between these two processes, which is named a sphenopalatine notch. A sphenopalatine notch at this area, when arrived to the inferior surface of sphenoid, they made a foramen. Look at here, it is a sphenopalatine notch. When attached to the sphenoid, they made a foramen, which is named a sphenopalatine foramen. A sphenopalatine nerve and artery travel from this foramen and arrive to nasal meatus. Which meatus? Look at here.
Middle one?
No, superior. It is located to superior meatus. Which concha is this? Superior concha. It is superior meatus. It is middle meatus. Okay?
The sphenopalatine foramen reaches the superior?
It is a sphenopalatine foramen
Yes.
which connect superior meatus to pterygopalatine fossa. I will talk about the pterygopalatine fossa in the next week. Okay? But here you know that this foramen is located medially between superior meatus, laterally pterygopalatine fossa. Third process of palatine bone is pyramidal process. Pyramidal process is located at the posterior side of the perpendicular plate and horizontal plate. It is horizontal, it is perpendicular, posterior to the horizontal and perpendicular. Here we have pyramidal process. Look at here. Look at here. It is pyramidal process. Here. Look at this area. It is posterior surface of body of maxilla. It is pyramidal process. I can say that pyramidal process attached to maxillary tuberosity, and also this process covers the pterygoid fissure. You remember pterygoid fissure? A fissure between medial plate and lateral plate of pterygoid process. And I said that medial plate attached to posterior border of pterygoid process. Yes? It is perpendicular plate of the palatine bone. It is medial plate. These two connect together. At the posterior side, we have pyramidal process, covers the pterygoid fissure and also attached to maxillary tuberosity. So, look at this slide and saying that, what are you doing?
Anesthesia for the great palatine nerve.
Yes, you are inserting the liquid, for example, the marcaine or the lidocaine, the anesthesia liquid into greater palatine nerve. No, I ask you that if I do this work, for example, can I remove the molar teeth without any pain?
No.
Yes.
Yes.
Who
Yes. No.
say yes? Yes, yes. Who say no? Why?
I don't know. I just remember when I removed my molar teeth, he did it here.
Because I said that the nerve, every nerve which innervate the teeth, it is named alveolar nerve. I said that posterior superior alveolar canal in the posterior surface of the body is the site of inserting the posterior superior alveolar nerve which innervate the molar teeth. So if I do this work, I cannot paralyze the nerve of the posterior superior and I cannot remove the molar teeth without any pain. Okay? Another question. If I insert the anesthesia liquid in the incisive foramen, posterior to incisive teeth, I have incisive foramen, yes? Can I remove the incisive teeth without pain? You answer.
No.
No? Why?
Because there is a eminence here. for the-
Yes, I cannot. Because I said that greater palatine artery and nasopalatine nerve insert to incisive foramen. Okay? Every nerve which innervate the teeth, it is named alveolar nerve. For example, anterior teeth are innervated by anterior superior alveolar nerves, not nasopalatine nerve. Okay? Another bone in the visceral cranium is zygomatic bone. As you can see, the zygoma made this eminence of your cheek in the lateral part of your face. I say that it has a body and it has two processes. The body of zygoma has three surfaces. Here is
Interior.
external surface, here is internal surface or lateral medial. Okay? Lateral and medial surface, and it is superior surface. Superior surface is also named orbital surface of the zygoma because it made the floor of the orbital cavity. Okay?
Doctor, is 2 process or 3?
How many processes?
Some references say that it had 3 processes, but the most reliable reference says that it has 2 processes.
Because
Okay? Yes, look at here. One process is named frontal
With the
process.
marker
One process is named
palatal.
temporal process,
Temporal.
which made zygomatic arc. But some references may say that it is another process which is named maxillary process. But we can say that it is not a process, it is some part of the body. Okay?
Okay.
So, the structures in the body. As you can see, posterior border, it is posterior border of the body of maxilla has two parts, articulation part and non-articular part. Articulation part made a joint. Which joint? Suture joint. Okay? It is a suture joint. It is a suture joint. The joint is an articulation. Yes? And also it has a non-articulation part. This non-articulation part participates in forming base of the inferior orbital fissure. It is inferior orbital fissure and it is the base of inferior orbital fissure. But sometimes in some skulls, maybe inferior orbital fissure is created by connecting greater wing of sphenoid to maxillary bone. Okay?
Mm-hmm.
At the orbital surface, at this area, we have a small foramen, which is named zygomatico orbital foramen. Zygomatico orbital foramen is like this canal, travel inferiorly and made to branch. One branch insert here and emerge at the zygomatico-facial foramen. One branch insert to the posteromedial surface and make zygomatico-temporal foramen.
Where is the beginning of the foramen?
Here, at this area.
That's mean
At this area.
Zygomatico-facial?
Yes. Look at here. It is a small foramen at this area, which is named zygomatico-orbital, because it is located in the orbit. Here is zygomatico-facial.
Yes.
What?
The location.
The location is here, in the floor,
Bilgi
of the orbit, and in the superior or orbital surface of the body of maxilla at this area. It is a small foramen. And at this area, emerge in the zygomatico-facial, posteriorly in the zygomatico-temporal. Zygomatico-facial, okay, is the site of exiting the zygomatico-facial nerve and artery, which innervates this area. Okay, zygomatico-temporal innervate posterior of the auricle at this area, and also make blood supply for this area. So, zygomatico orbital, zygomatico facial, and posteriorly zygomatico temporal. It has two processes. Here is
Frontal process.
frontal process which attach to zygomatic process of frontal bone and made the suture. What is the name of the suture?
Front.
Zygomatico frontal suture.
Zygomatic front.
Okay? 1 centimeter inferior to the zygomatico-frontal suture at this area at the level of lateral wall of the orbital cavity. We have a small tubercle, which is a small tubercle is the site of attaching of lateral palpebral ligament and some fiber of the levator palpebral superioris. Okay? These two structures attached to this area. Another structure at this level, I talked about the process. Maybe you read in some references jugal point. Jugal point is here when the temporal process attached to frontal process at this area. It is named jugal point, which it is important in the craniometry, but maybe you read in some references. The fracture of the zygomatic arc, if just this level at the site of this suture, what is the name of this suture?
Zygotemporal.
If fracture of the zygomatic arc results in the displacement of this suture, just you should fix the inferior jaw of the patient, because this site, inferior border of the zygomatical arc, is the site of attaching mesenteric muscle. The mesenteric muscle attached to the zygomatic arc and zygoma, and inferiorly attached to ramus of mandible. Okay? If you fix the mandible and the patient cannot talk, this replacement will be treatment. But if fracture made this shape, multiple fracture of the zygomatic arc needs to a surgery and to fixation of this plate.
So if it's one fracture, they have to wire shut his mouth.
If just we have one fracture which result in the replacement of the zygomatico-temporal suture, just the doctor should fix the mandible. But if the fracture is the multiple fracture, okay, and we have several segments of the bones, the surgeon should make an operation and make a plate at this area for the fixation of every of these parts.
بلاتينيوم بلاتينيوم نفك عن ايه لا هو
What?
he said he should put platinum here and fix
Yes,
it.
platinum. He has platinum.
No, thank God.
Yes, these plates are platinum plates or platinum blocks.
Yes.
Another bone is nasal bone. Nasal bone is paired or unpaired?
Paired.
It's a paired bone. Yes, it is located at this area. As you can see, every nasal bone has two surfaces: external surface, internal surface, and it has four borders. Look at here. Superior. It is anterior, posterior, superior, inferior. Superior border attached to
Frontal.
nasal notch of frontal. Anterior borders attached together. Inferior border attached to lateral cartilage of the nasal. And posterior border attached to which part of maxillary? Frontal process of maxillary. Yes. When you see the external surface, maybe you see one or two foramens, which emission rays travel between two foramens. If you look at to the internal surface, you can see a vertical groove in the internal surface of the nasal bone. That external nasal nerve travel between this groove. Okay? Decide that two nasal bones at the midline connect together and superiorly connect to nasal notch. This area is named nasion. Yes. When you read nasion,
I take the review about the
Yes.
subject. So
this is nasion. What is inion?
شو تحت النظر؟
Union.
Yes.
External, occipital.
External occipital
Occipital.
protuberance At the
Inion.
highest point made the inion. Yes. Okay, very good. What is basion? If here is foramen magnum, anterior border of foramen magnum is named basion. Base,
The basal.
yes, the base of the cranial
That means
fossa.
the condyle is there and
No, not condyle, just foramen magnum. Anterior border of foramen magnum is named basion.
is external or internal?
Internal.
Okay.
In the internal view of the skull, the posterior cranial fossa has foramen magnum. Anterior border of foramen magnum is named basion. What is obsession? Obsession is posterior border of foramen magnum. Okay?
Okay.
What is posterior? What is terion?
Friction is something here.
You should answer all these questions.
So, doctor, we have special names or special names for a special portion in the bone. Like, what the main function of this is?
This is site of the location.
This location?
Yes. For example, terion is a location.
There is some benefit.
I will show you terion and posterion. Look at here. This is terion. Terion is an H-shaped suture. Terion is an H-shaped suture which is seen in the lateral view of the skull. Look at here. It is H-shaped. Okay? Anteriorly is the coronal suture. Posteriorly, which suture is this?
Parietal.
This is
Squamous.
between greater wing of sternum and squamous of temporal. It is named sphenotemporal suture at this area, and posteriorly here is squamous suture. Okay, this H-shaped suture in the lateral view of the skull is named terion. What is osterion? Osterion is posteriorly. When longoid suture, okay, longoid suture connect with squamous suture. Here is longoid, yes.
Yes,
Here is
yes.
squamous. When they connect with them, this area means is named osterion. Okay. Osterion, terion, opistion, basion, nasion, inion.
But doctor, this is the end. Is squamous or another name is called
This is
has another name.
contain another. Look at here. It is terion. This H shape is terion. It is coronal suture. It is a squamous suture, and it is also some part of the squamous suture. Look at here, and this suture is named sphenotemporal suture. Okay. This H shape is terion, and terion is an important landmark during accident. Every accident and every injury to the terion area, because terion is the site of attaching several sutures, and sutures are susceptible area to damage because they are thinner than another part of the skull. Any injury and any accident to this area may result to damage to frontal branch of middle meningeal artery, because frontal branch of middle meningeal artery is located in the depths of pterion, and it may extradural hemorrhage. Okay, extradural hemorrhage. It is osteurium here. Here is osteurium. Squamous suture connect to lambdoid superiorly, and what is this suture? Occipito-mastoid. It is mastoid, it is occipital. It is occipito-mastoid suture. It is lambdoid suture. Okay? When lambdoid, occipito-mastoid, and squamous suture arrive together, this area is named osteurium. Osteurium is the same, which fontanelle? Mastoidal fontanelle. Yes, in the baby, mastoidal fontanelle is located at this area. This was a break for you. Yes?
But the doctor, the posterior frontal is here?
Yes, posterior fontanelle. When sagittal suture.
Yeah, it's here.
Yes.
So what is
No.
this?
By now you don't have fontanelle.
Yeah,
Fontanelle
just
just
in
the
the-
same in the baby. Okay? But yes, sagittal crosses with lambdoid. This area is
Posterior.
posterior fontanelle. Sagittal crosses with coronal anterior fontanelle. Here, the area of the pterion is sphenoidal or anterolateral fontanelle. The area of osteurium is posterolateral or mastoidal fontanelle. Okay? Very good. So, you are not tired, yes? Continue.
كانت اقطع الفيديو صار 40
What?
اقطع 40
The nasal bone.
هاي تعال تعال سوي تعال
لا لا